What do you think?
Well, then it's not exactly at the same time if you're doing it on different days.
No. It must not be exactly at the same time. But having one patient coming to you with migraine, for example, and you do some homeopathy, and the patient is going to another doctor who's doing some acupuncture.
Oh, that happens.
That happens.
Yeah,
Would
that
you recommend
happens.
it? Would you
Do I recommend it? No, I don't recommend it, because
Why
then
not?
it's hard to gauge where my treatment's going versus how their treatment's going.
Okay. So I know lots of homeopaths who also do acupuncture, but not at the same patient at the same time. They have to decide when they use acupuncture or homeopathy, okay? But what would Hahnemann say? Would he say so to his patient, I administer a homeopathic remedy and you must not use any other therapies, energetic therapies until we are finished? What would he say?
What would Hahnemann say, guys?
What would Hahnemann say?
Hanuman says, don't use another therapies.
Okay, when we refer to Organon, we see that Hahnemann highly recommended mesmerism. Okay.
Oh, right. Yeah, we just talked about this with our last webinar. I love using mesmerism myself.
Mesmerism is
but I don't do it at the same time exactly as giving a remedy. But it also stands outside.
Not at the very same time, but he
But it's
recommended.
mesmerism isn't going to be the same effect because you're clearing the energy field, but you're not adding dynamic energy in the same way that you are with a potentized substance.
Well, but at least Hahnemann, he in his patients also in the course of the homeopathic treatment recommended the mesmerism. So there is no absolute need to neglect other kinds of dynamic treatments, okay, in the course of homeopathic therapy.
Yeah, but mesmerism, I think, stands alone in a different way, stands separately, because it has its more of a like temporary effect, and not like somebody going off to go and get their Reiki treatment is a little bit different than you're going to do a little bit of positive mesmerism on your patient, etc. It doesn't seem quite the same as an intensity.
Maybe not quite the same, but the question is, what does any energetic therapy, can we combine these? And what happens to our homeopathic remedy when we combine these energetic therapies?
Well, I guess if we combine them with logic in a logical method, then that wouldn't be the same thing as you've got one person doing this kind of treatment on the person, and then you're doing this kind of treatment on the person.
Yeah,
and
exactly.
Then it's, you know, but if you're trying to do some kind of thing that meshes together, that's different. Yeah,
exactly. They have to fit together. They have to make sense. They have to supplement or support each other in their action. Okay.
That's what I'm trying to say in a very roundabout way.
Yeah, for myself, would not recommend a patient which comes to me for homeopathic treatment. I would not recommend to go to a doctor to have acupuncture at the same time or at the following day. Okay, because I do not know what kind of therapy or what direction he tries to give to the patient. Okay.
But at the same time, I'd say that when we do give somebody a dynamized dose of medicine, that it's really hard to dislodge, to remove, to stop that medicine from doing what it's doing.
Yeah.
In my opinion.
Okay.
And
let's
it is
move on.
also, hello, it is
Sure.
also difficult to assess the medicine, which therapy is acting. And if there is a homeopathic aggravation, what you will do? Combining these two therapies.
If there is a homeopathic aggravation.
If there is a homeopathic aggravation and you are doing acupuncture also.
Well, I do not use acupuncture. I use the remedies on the skin. So if there is an aggravation, I do what I always do when there is an aggravation. I take up the case and decide if there's I have to change the remedy, because the first effect, I guess, comes from the rubbing in. So there is an instant effect by the rubbing in of the remedy, and there is a lasting effect given by the homeopathic remedy. And if the effect, the aggravation comes from the remedy, then I have to decide if I have to choose the remedy or if I have to antidote or whatever. So now let's move on. There's a statement of a German homeopath. There are no two methods in medicine which do perfectly fit together and supplement. Oh, wrong writing. Supplement each other like acupuncture, especially ear acupuncture and homeopathy. This is from an acupunctural point of view. And this is, I just want to leave this uncommented, but because times is very advanced, I'd like to give you some advantages of why we should apply the remedies on the skin based on the details given by Hahnemann. And there are some other aspects which might be beneficial to us as a therapist and to the patient himself. Okay, so why should we use local applications? Sorry. Well, as I heard, as Tikva said before, in some countries, we are not allowed to touch the patient, which I find is very difficult in the treatment. And in homeopathy, we often just talk to the patient. And it is important, as I think, to come in touch with the patient and so that the patient can feel that we are working on the patient. We see where the problem is, we feel with our hands, and we go to that point which is painful, where there is a disturbance, okay? The other aspect is that we enhance the action of the remedy, as Hahnemann said before, and we might speed up the cure. And you will see that, especially in chronic diseases, the patient will, the day after the treatment or the first few days after the treatment, he will call up and say, there is a change in the state of health. Okay, we all agree that the disease, especially when it's long lasting, will not disappear in a few days. We'll not promise that, but he will have a quite instant effect. Maybe one of the most vital aspects is that we as therapists have a total control about the dosage and the repetition of the remedies. Hahnemann recommended the application, on the one hand, given the dose orally, and then rubbing the remedy in on the skin. Okay. I myself, I just use the dermal application. I do not administer the remedy orally. And so I have the total control about the dosage, how much of the remedy the patient will get. And this is a part of the drop dose if you use it locally on the skin. It's a minimum dose. I put 2 pellets of the remedy into some water and use 1 drop of this remedy locally on the skin. I rub it in. I have total control of how much of the remedy the patient will get, when the remedy is repeated. As you all will have experienced in your practice, it's not often that easy to keep the patient from taking remedies by himself. Okay, you write it down, you hand out the recipe, you send him home and say how much he has to take and when to take, and maybe he has only to take a high potency just once or every 2 weeks. And then he calls back and says, well, what do we do? I don't have any remedy left. We know that he has overdosed. So what do we do now? Sorry? Okay, so this.
Yeah, Sanjay, something happened to your video and you're all garbly in your audio. Your video's off and you're garbly in your audio.
Okay.
You want to use the typing feature?
नहीं इधर चालू ही है रिकॉर्डिंग टिको तो बोल रही चालू मेरा माइक्रोफोन चालू है
Okay, do I go on?
I don't know what's going on here. Let me just send him a message.
ऐसा करो सब बंद हो जाएगा
Our co-host is having a technical difficulty.
So I guess I'll continue, okay?
Yeah, you continue. He's having some kind of technical difficulty and I don't know what to do about it because I barely know how to use this technology.
Okay. So let me give you a case, an acute case of tendovaginitis. And this was a male patient, 45 years of age. So just that you can see how I'm doing this in my practice. Okay, he was in a good general state of health. Pain at the right wrist since 2 days. He was sitting for long hours at the computer, had to do some work for an important meeting. The wrist was slightly swollen and very painful, especially when using his fingers, grasping, etc. The causation was the strain from long continued computer work. He has also already used an anesthetic ointment with short amelioration. Okay, so after the anamnesis, I came to the conclusion that ruxtoxirendron would be a suitable remedy. And so I made the physical examination and I found a painful, very painful spot at the trapezius muscle. And it was the important part of this point was that when I pressed this point, there was a painful sensation in his wrist, okay? Exactly at the point where the wrist was painful. So I pressed this point at the trapezius muscle and he had a painful sensation at his wrist. So obviously there was a relation between this painful spot and the disease at the wrist. There was another very painful spot localized at this wrist. So I applied the remedy locally at these 2 points. And after 5 minutes, the patient realized that these pains are decreasing, okay? It was 5 minutes and then the pains were decreasing. He called back the day after and it was 80% rate amelioration, and the day after it was completely gone. But he realized also already right after the treatment that there's an amelioration. Okay, so the effect is very instantaneous and can be felt by the patient right away, often even when he's still in the office. Okay. The Q6 potency is the LM or Q potency,
Yeah,
kind of
LM.
Kind of special potency.
LM potency.
Genau. He did not want to mention this, the similar puncture. I call this method, it's based on Hahnemann, as I said before. But at one point, we have to leave his teachings. That's when it comes, for example, when it comes to the administration of the remedies on the back of the body. Which means Hahnemann, he led us to a certain point, but new findings have shown that homeopathy can be supplemented if we try to integrate other kinds of therapies, like trigger point therapy, the experience of thousands of years of acupuncture. And so this is a kind of holistic treatment. Okay, we try to be open-minded for a new approach. The effectiveness of the therapy depends of the choice of the most suitable remedy. On the one hand, it's we cannot use any remedy which we like, but we have to find the minimum. It depends on the right potency. It depends on the repetition of the dose. These are the homeopathic aspects, and this is the special point. It depends on the localization of where we apply the remedy. Okay, I really believe that this therapy or kind of therapy is according to Hahnemann. However, I gave it another name because there are so many different schools in homeopathy that it's hard to define what is true homeopathic Hahnemannian homeopathy. Okay. So finally.
Oh, excuse me, Andreas. Okay, Sanjay sent me a message saying that he's having technical difficulties to the point that he needs us to take a break so that he can restart the thing. Does that make sense?
Advanced. This is the last, the end of the presentation. Should we finish it or?
I'm messaging him.
The last picture, then I'm through. Then we could make some questions and answers if there are.
Okay, he said go ahead.
Okay, then I go ahead. Yeah, thank you. So another quote from a German doctor and surgeon: what we have gained through X-ray equipment, we have lost from our fingertips. Okay, just a hint that we might use more or focus more on the physical examination and try to integrate these painful spots and areas on the body for diagnosis and for therapy. And I did not explain my practical approach in detail, but I hope you have now have a perception of the possibilities of the dermal applications of the homeopathic remedies. And so I hope you enjoyed this this presentation. If there are any questions, you can email me. My website is similarpuncture.com. There's also the email given, and I'm really excited about your feedback. Thank you very much.
Well, thank you, Andreas. That's been very interesting. Do you think we should give Sanjay an opportunity to restart his thing so that then we can come on and have a short question and answer?
Yeah, no problem for me.
Okay. Is that okay with everybody else?
Yes, we are okay.
Okay, because he's stuck and he's missing out on everything. Now, I don't know what that means that I'm supposed to do as the co-host or you co-host. This is complicated.
Hello.
Oh, there you are. But there's no picture.
Actually, I lost controls.
You lost controls.
Oh, there you are. Okay, we're fine now.
Okay, continue. We will see
Okay.
if recording. Can everybody see recording is on?
Yeah.
Yes.
Mhm.
Okay.
Recording's
fine.
on. Everything's going fine.
You can continue. We can end up and see if it works.
Okay. So
Okay, so questions and
finished.
answers, anybody?
Questions? Any comments?
Questions, comments, this is your time. Take
Yes,
your
I have a question.
opportunity. Okay, Faisal.
My question is, what is difference between oral dose and dermal dose? Because when we say oral dose in homeopathy, it's not oral. It's not oral like allopathy. It is just like touching the medicine to the skin of the tongue. And when we say the dermal dose, it is also touching the medicine to the skin. So what is different between oral dose and the dermal dose?
Well, if we look upon oral dose as a kind of dermal application, it's quite the same. But as I said, I use the dermal application on painful localization or special localization. Sometimes if I do not find any painful spot on the body, I use acupuncture points which have a similar action or which might supplement the action of the homeopathic remedy. Okay.
All right.
How you choose? Hello.
Yeah.
How you choose acupuncture points?
How to choose?
Acupuncture points.
Yeah. Okay, I got you. Well, at first I look for painful spots and try to see if they are linked to the disease itself. We all have painful spots on our body. Right now, if we have some physical examination, there will be some points which are more painful than others.
Ashi points. Ashi points.
Ashi points. Yeah, you mentioned these Ashi points. Ashi points are points which are quite painful. They might not be acupuncture points. And when you press these Ashi points, then there's there he is, this point painful spot. But it's important not only to find a painful spot, but to relate this painful spot to the disease itself. When we have, for example, a headache, a patient is coming with headache, left-sided headache, and you press a point in the neck, and then the patient has this Ashi point. Okay, this is very painful. Then you might have a link because lots of headaches are originate in the trapezius muscle. As I said, in the case of the tendovaginitis, when you press this point, and the patient has a feeling, you press this point here, and the patient gets a feeling, something is wrong here above the eye. Then you have a clear a clear link between this point and maybe the headache. Okay, and you have to find these points which are related to the disease. It does not. When you have a patient, a female patient, for example, with dysmenorrhea, and you have a painful point here in the trapezius muscle. I guess we all, as we work on the computers every day, we sure have painful spots in the neck, but it will not help the patient with menstrual pain. Okay, so you will look for a spot in the lumbar region, for example. Or the patient can tell you, there is a painful spot right here, and yeah, which you cannot explain why this pain is here, but it's always there, and it can be felt on slight pressure, and or it is painful by itself. Then this is giving you a hint that there is a disturbance here at this local point. Okay.
Only local points are sufficient, or one has to go to the meridian which is affected?
I don't use these meridians. Sometimes, as I said, if I do not find any painful spot which I can relate to the disease, I try to use an acupuncture point. For example, we know some acupuncture points, they lower the blood pressure, or they have an effect on the pelvic organs, or on the respiratory system, and so on. So when a patient is coming with these issues, then I try to use these points.
Okay.
But the difference to classical acupuncture, there are many differences to classical acupuncture. In acupuncture, you often use 10 or 12 needles. You use many different points, but in my therapy, I just try to use 1 or 2 points, not 10 or 12 different points where I apply the remedy. Maybe only 1 point, maybe Ashi point. Okay.
Oh, yes, sir. Yes.
So the minimal dose is for me one rule where I do apply. Okay.
Oh, thank you.
You're welcome.
We had a question from Siva Kumar
in the chat.
Yeah.
The patient comes with pain in different parts of body. Do you apply needle in single point? Well, I do not say I apply a needle. I use a special instrument from Chinese medicine, but I do not want to explain this in detail now. You can use, let me say what Hahnemann, he recommended to dip the fingertips into the solution of the homeopathic remedy and then rub the remedy in until the skin is dry. Okay, so you could use a kind of an instrument to dip it into the solution and then apply the remedy on the skin, as you do not want to touch it with your hands. Okay? Because
you don't want to dose yourself.
You don't want to dose yourself, exactly. And then with the next remedy from the next patient. Okay. So I do not use a single needle. I use a special instrument from acupuncture. If a patient comes with pain in different parts of body, we apply needle in single point. Okay. No, I do, as I said before, 1 or 2 points at a time. Homeopathic disease remedy diagnosis, I do not think that it's very helpful to try to bring acupuncture, classical acupuncture, and the classical perception of Chinese medicine together with homeopathy. So the perception of the remedies and their function is totally different to what we think in Western medicine, and Hahnemannian homeopathy is based on Western medicine and the perception of the organs and their functions. So we should not mix it all up. Maybe sometimes or one time we will find a way of how to combine these things, the homeopathic materia medica and the Chinese materia medica.
That sounds like a big challenge.
This is a really big challenge, and
Yeah.
I got some books where the author tried to manage it, but it's not that helpful, I guess, not for homeopaths and also not for acupuncturists. Okay. So the diagnosis, I do not make Chinese diagnosis with pulse diagnosis or tongue diagnosis, even though I'm sure that these aspects will also help us if we understand what it's about. We might integrate this in our homeopathic therapy or in the diagnosis. Dr. Gitte, you agree? Dr. Satish Gitte. Sorry, can't hear you.
His microphone is off.
Your microphone is off, sorry.
You are doing unique work, sir.
Sorry, did not understand.
He said you're doing unique work.
Unique work, thank you.
Yes,
Yeah.
yes, absolutely. Absolutely.
Yeah, but I hope you might get interested in it, and as I think it might pave a new way in homeopathy and open up a new perspective if we can integrate the knowledge and the experience of other great therapies.
Yes, yes, yes.
Homeopaths, we are often a little closed down when it comes to other methods, and we refuse them, and we think that acupuncture, for example, has a history of several thousand years. So compared to this, homeopathy is a quite young science, and if we can integrate this knowledge into or try to find a way of how to integrate this knowledge into our treatment, this will be very beneficial.
I want to speak about Ayurveda also. I want to speak Ayurveda with Ayurveda also, the same type of things. There is so many medicines in Ayurveda which is potentized.
Okay.
So many
Sure.
Ayurvedic medicines are potentized, and there is also some concept in Ayurveda with potentization.
This is a very important and very interesting point. Thank you very much for this. If we think of Ayurveda, there is a long history of Ayurvedic acupuncture, I think, and there's a totally different kind of energetic system in Ayurveda with the chakras, for example. And if we get an idea of the chakra and disturbance of the chakra, we might even integrate this when we use the remedies at the chakras, for example. Use another kind of energetic systems. Okay, I know some colleagues. I heard about colleagues who they apply homeopathic pellets at ear acupuncture points. Okay,
Yeah.
these tiny pellets, and so the patients can stimulate these points. So there are different, many different ways of how to combine these remedies. We cannot mix all up and leave all our rules behind us, but we should try to integrate what makes sense. Okay.
Yes,
For
yes.
me,
Yes,
for
yes,
me,
yes.
the application of a remedy on the skin, on a painful spot. What is this painful spot? On this painful spot, the body sends a signal, and he sends a signal to the external surface of the body that there is a disturbance right here at this point. Okay, we do not know what it means, but it's the patient is talking with sign language, and we have to understand this sign language. And for me, it is obvious that here the organism is sending a signal about his disturbance, and I try to use this point as therapeutic for therapeutic effect. Okay.
No, this is only starting.
Okay,
It's
so
only
Biju
start.
Cigar had a question saying, what made you think to do this?
What made me think to do this?
What gave you the idea?
Well, the idea came when I studied Hahnemann. I'm a lecturer of homeopathy, and when I studied the organon, I found these statements about the rubbing in. Then I started studying his different books, where I find something about these kind of application. And when I stumbled upon the statement that especially in chronic diseases, and I would ask you all who joined this presentation, I would ask you all look back at the sources which I gave you, which I talked about. Start with the medicine of experience, where it is mentioned what Hahnemann found. Read the different editions of the organon, and so make up your own mind if it makes sense to apply these remedies on the skin. Try to find out what Hahnemann said about it. And yeah, for me, it was absolutely logical to try to combine when Hahnemann says the action of the remedy or the progress of the cure could be increased by this dermal application. I think this is a very vital point, and we should. We should. Well, I'm sorry.
You can experiment it with it. Okay, because see, I commonly will use a conjunction of using the medicine internally as an oral dose or an olfactory dose, and then perhaps also use rubbing at the same time. But I have never tried rubbing in specific areas. So we can experiment with rubbing in specific areas according to like what the information we've gotten today, and see how this benefits our patients.
One central question is why will the cure speed up if we apply the remedy on the skin?
And you know the speeding up the cure is very important.
This is what I asked me myself. Why should the cure be speed up or be accelerated if I administer the remedy on the skin? Well, first, Hahnemann, he taught us we should give the remedy orally, and the next day the patient should rub it in, okay, at different areas on the body. So what makes this effect so that the cure is accelerated? What is this effect? Is it we would not ask our patients to take the remedy daily, or would we orally? In some cases we would, but definitely not in all cases. Okay, and so the question is, why should the dermal application speed up the cure? Is there any explanation for this? And there may be one explanation. It was a doctor from Switzerland, Professor Bergi. I'll type it down. He was a doctor and a pharmacologist, and he investigated on the action of multiple remedies given in one patient. Okay, so what happens if when a patient with a heart disease will get 2 heart remedies? Will the action of the remedies will
Conflict?
sorry?
Conflict?
How do these remedies act together? Will the action be increased, or will it be doubled up, or will it be potentized? Will the cure, the effect be much better or just a little better? And he found that 2 remedies, 2 heart remedies, it's not when a patient comes with back pain or heart disease and he gets a heart remedy and a painkiller. It's not that about that, but 2 heart remedies, for example. And he says when the remedies both act on the same organ and have the same kind of action, then the effect will be doubled. Okay, then the effect will be doubled. But when 2 remedies are given to the which act on the same localities, localizations, like 2 heart remedies, and they have a different kind of action, then the effect is much increased, is potentized. Okay, and this is what Hahnemann found, and this is what I think is the key why the dermal application will speed up the cure in chronic diseases, as we have different kinds of action. We have this remedial action of a homeopathic remedy, and we have this stimulation of, for example, acupuncture points or other functional points on the body. And if we manage to combine these actions, the action of the stimulation of the point on the body and the remedy, then the speed or the cure will be accelerated. Only if these 2 fit together. Okay, so if we have, for example, a patient coming to us with female patient with menstruational disorders, and we have the right remedy, for example, sepia, and we have a painful spot in the lumbar region, which we know from acupuncture or from the head zones or whatever, that there's a relationship between this point or this region and the female generative organs. Then the action of the homeopathic remedy can be combined with the stimulus of the point, and then the action or the cure can be accelerated. And I guess this is what Hahnemann he experienced and saw. Okay, you understand what I mean?
Hello, sir.
Yeah.
So, sir, in this case, how will we decide the potency of sepia? Is there any way the potency to apply, like you said in this example?
The potency to apply, I would recommend you apply the potencies from your homeopathic experience. There is no, I used this method for about 3 years now. and I use the potencies which I use in everyday practice, or I used in everyday practice before I did the dermal application. So you can use any type of potency you want. Okay.
Okay. Okay. Thank you, sir.
In chronic diseases, you can take high potencies just as according to your experience. Sorry.
Okay. Thank you, sir.
Yeah, you're welcome. So
Any other questions?
So there's a question, one should be aware of acupuncture points. Why should you be aware of an acupuncture point?
I think he's asking, do you need to know acupuncture points or just painful points?
Well, it's definitely helpful to study the acupuncture points in their action. One of my first patients, he came with chronic stomach disorders, and he had a very painful point right beneath the sternum, and there is an important acupuncture point for diagnosis, for example, for stomach, and which is used in the treatment of gastritis and several other issues. And so I applied the remedy to this point, and without knowing at first about the action of the point, so I had to study the point and look if the point and the disease picture they are connected. Okay.
Back shoe points. Hello.
Back shoe points. Ah, yeah. Okay. These are the alarm points. As far as I know, and these are on the back of the body, as I've shown before. There are points which are connected to internal organs. So this is what the back makes a special localization for the administration of the remedies. However, there are many different other points on the front of the body. There's a very important point between the thumb and the index finger where the remedy can be administered, and yeah, according to the case.
Here?
Yeah, here, exactly. Yeah, you use it on the outside. Yeah. A very important acupuncture point, and you can, if you study the acupuncture point, then you will get an idea of what remedies you might use at these points. Okay. So now any other just painful points enough? Yeah, if you get a painful point and can relate this point to the disease, then one point is definitely enough. You don't have to look for more than 1 point. You don't have to apply acupuncture rules. There are many different rules in acupuncture. So if you find 1 point, this is enough. Okay. Any other questions? Any other comments? I really like you being, is there any restricted point? Well, there are some areas which are quite difficult to treat. Comes to the face, for example, but as you all might have experienced that, for example, ear noises, tinnitus is very hard to treat. with homeopathy, but if you mix it up with acupuncture, there's a point right in front of the ear. Here. When you apply the remedy there, then you often get, even though if the ear noises have existed for a very long time, for several years or decades, they will not maybe totally disappear, but these inveterate cases where homeopathy is quite complicated and often not that successful as we want it to be, then you can apply the remedy here, for example, right in front of the ear. So oftentimes the remedy can be applied in the neighborhood of the seat of the disease. Okay, you might apply it here, or you find a painful point at the trapezius muscle. Okay. So this is what we can learn from other therapies, like also the cupping therapy. In cupping therapy, there are also several areas, especially on the back, where the cupping has led to disappearance of long-lasting symptoms in the head, for example, sinusitis and so on. So when we use these points, then maybe sinusitis will disappear in a short period of time. So another question, please explain how many globules and how much water and to rub for how much time. Yeah. Okay, I usually put 2 pellets into some water and then rub a minimal dose of this remedy, of this solution to the point. It's not that you have to take much of this solution on a large area. If you take it to the point, it might be 2 or 3 drops of the remedy. Okay, this will be sufficient.
Do you wear gloves when doing this treatment so that you don't medicate yourself by accident?
As I said before, I use an instrument from Chinese medicine, and so you can not, how can I say? There are many different ways, and you can be very artistical when it comes to
just
that.
Wing it, right? Wing it.
You could, before applying the remedy, you could rub the skin. There are many different ways of how to stimulate points on the body. You can rub them, you can squeeze them, you can apply heat, you can apply cold. What you should not do is to put any ointment whatsoever or any oil on that point, because that might keep the remedy from acting. Okay, but you could, for example, rub the skin for about half a minute, and so then what happens? The acupuncture point is stimulated, the tissue is the metabolism is increased, there is increased blood flow, the part is getting warmer, it's getting heated. And this is what Hahnemann found, that the remedies act better when the skin is rubbed. Okay, so before you apply the remedy, you might rub the skin, increase the metabolism, and then you can apply the remedy, for example, with some cotton. So you don't have to touch the solution. This is a very vital point. Don't touch the solution and get medicated. Okay. You can get creative and think about how you could apply the remedy.
sir, do you feel is it essential to apply the right medicine with puncture, or simply rubbing and giving some pressure over that painful area is enough?
Yeah, this is interesting question. Well, I guess after with my experience, I guess the rubbing or the stimulation of these acupuncture points or any other points, maybe trigger point or whatever, gives an instant effect. However, if you as a patient would go to an acupuncturist with, for example, backache. You have chronic backache, you go to an acupuncturist. So he will do this treatment about 2 to 3 times in the beginning a week. Okay, you have to repeat this after a few days to have an effect, a lasting effect. Okay, so the stimulation or the acupuncture needle will act, but this action will decrease after time. So in the beginning of the therapy, you will have to visit your acupuncturist every few days. So with the dermal application of the remedy, you have this instant stimulation, and you have this lasting effect of the homeopathic remedy. So when, for example, the remedy is not well chosen, it only partially fits to the disease of the patient, then the effect will not be that lasting. However, you will have an effect from the rubbing in. So the patient will be quite confident and hope that you will help him with the rest with lasting effect. You cannot, we should not think that after one application of the remedy, if you apply the wrong remedy, the effect will not be that lasting. On the other hand, if there is a lasting effect, we cannot think that the stimulation, which is done one time, will have this long effect. Okay, the remedy is giving the long-lasting effect. The stimulation is getting the instant effect. That is my theory of it.
Oh, thank you, sir. Thank you.
And if you only have these instant lasting effect if both actions fit together. Okay.
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 Because nowadays many classical acupuncture people's moving from needle therapy to acupressure, then that people move from acupressure to acutouch like that. That's why I asked that question, sir.
Okay. So there's another question. What is best rubbing point during temples headache? If you have a painful spot in this in the area, then you take this one. On the other hand, if you do not have your patient, if a patient is coming to you and complains about headache, he may not have this headache at the time he's in your office. Then you look for other painful points on the head, for example, or especially in headache, especially in the trapezius muscle, where you will find some painful points. But if you suffer from the headache, then you might apply the remedy locally at the temple. Okay, and often there is one pinhead painful point in this area, and you take this point. You don't have to rub it in at the whole temple. You look for this one point which is extremely painful. This is where the organism wants you to help. Okay.
So you're saying that the body is giving signs of where to help guide the treatment using the correct potentized remedy.
Exactly.
Mhm.
Exactly.
I think we can sum it up like that because we're just about out of time here.
Yeah. Just another question about the dermatomes. I'll answer shortly. Dermatomes, yeah, you can apply the remedy to the dermatomes, and what we use is the QT visceral or the visceral cutaneous effect. I guess we've heard about these effects where you can influence or affect the internal organs over the skin. And the dermatomes, well, they are similar, okay? But dermatomes are areas, and we look for especially for spots, so that the remedy can apply it on single spots. But if the dermatome is affected, then you will find one painful spot, I'm sure.
Okay, great. Well, this has been very informative, and we really appreciate you joining us today. Thank you very much.
It was a big pleasure for me, and I hope it has given you some inspiration. And as I said before, if there are some questions, please feel free to ask. Contact me via mail or whatever. And yeah, tell me about your experiences. Thank you very much.
And thank you so much for joining us. We really appreciate it. And thank you. And thank you, everybody, for joining us. And thank you for your good and pertinent questions. And I hope we've all gained a little something here that we can apply and at least try on ourselves until we feel comfortable on others. Because we can always experiment on ourselves first. Okay, Sanjay. Are you able to end the meeting, or are you still stuck? Sorry, guys, the meeting's, I think he's stuck out there. Okay, so I guess what we'll have to do is we will have to individually close ourselves out of the meeting. You see on the lower right-hand corner of your screen, there's that red button that says leave. I think that's
Okay.
what we're going to have to do.
Bye.
Okay, thank you so much.